For my internship, I worked with Linn County Public Health on their community health assessment and community health improvement plan. And through that, I got to apply research methods that I had learned in class and then take those methods and apply our findings to finding solutions that are going to work for the community.
Last summer, I had the opportunity to go to Western Kenya, where I worked with an organization about child mortality, so figuring out why kids under the age of 5 die and what we can do to better intervene and make sure that doesn't happen.
So my experiential learning was in Romania. I went to the Cluj School of Public Health. And so what I learned was about how, when people are brought up, how their emotional health is tied to smoking behaviors.
For my experiential learning program, I got to go on a service learning trip to Jicotepec, Mexico. And through that, I was able to plan and then execute focus groups with middle school students. And we worked alongside their school administrators to plan and then execute that. And so through that, I was able to learn about cross-cultural learning and then also how to work with communities outside of my own.
For my experiential learning program, I was able to complete a research internship at the Federal Institute for Risk Assessment. I studied our exposure to air pollutants, and I learned how to be a more detail-oriented research scientist and public health professional.
During my internship with the University of Iowa Physicians, I worked with the team to improve patient outcomes and experiences so they get the care they deserve and need.
I got to be a research assistant with a professor here at the college, conducting interviews, investigating reasons why people use e-cigarettes. I really got a lot of experience in how public health professionals conduct research, experience with interviewing study participants, and a lot of good experience with doing data analysis and stuff after the fact.